Welcome to the Man Cave Podcast with Dan Casper.
It's time for a little Inside the Trading Room with Dr. Crow from Chippewa Valley Orthopedics and Sports Medicine. Austin, how you doing, man?
Fantastic.
That, oh boy. Hey, last week, let's start with a little hoops. So last week, we talked a little bit about Giannis and his calf injury and such, and it was reported earlier this week already, like, was it on Tuesday, that the Bucks, obviously it's reporters out there, but they were saying that the Bucks were preparing for Giannis to not be ready for the beginning of the series, and I don't know what they mean by beginning. Is it 1 game, 2 games, or anything like that? But, you know, with that already being out there on a Tuesday and they don't play on Sunday, is there maybe a little bit more concern potentially with that calf injury? Maybe there's a little bit more going on, or does that still kind of fit the time frame with that type of injury from Giannis?
Yeah, I mean, I think that could easily fit within the standard time frame, so I wouldn't read into it too much. Now, if it starts leaking beyond that window, then you start wondering if it was a little more severe than initial reports kind of indicated. Additionally, we talked about this as well, that there is also the component of kind of Achilles tendonitis he's been dealing with, and the last thing anyone wants is to see that Achilles pop in him, right? So I think they're gonna keep an eye on that as well. So occasionally you get an injury adjacent to a previous one that aggravates it or exacerbates that as well. So it's possible that may be aggravated. But I think if you look at a kind of a 2 to 4 week window, which is what this will be, I don't see that being outside what we consider normal for. I mean, because obviously it's a pretty good injury. I mean, he went down. So I mean, it wasn't just like a mild tweak, as they like to say. So I think it was a pretty significant injury, and as long as things go according to plan, 2 to 4 weeks is well within that normal window. So I guess unless it changes significantly, I don't think it's outside of a normal window.
Then tonight with the Heat, Jimmy Butler has already been ruled out, and they're calling it an MCL sprain. And I saw one report from the Miami Herald that he's expected to be sidelined for several weeks, and he suffered this injury, it looked like, in the first quarter of the game the other night. He landed awkwardly on that knee, but he still continued to play with that. Now he's done for several weeks with an MCL sprain. Now, I know there's different levels of a sprain, correct?
Yep, grades. Yeah, we use the term grade. So, interestingly, MCLs, because I think his was a non-contact. Didn't he just kind of land awkwardly?
Yeah, yep.
I think I saw a description. I didn't see the video of it, but that's a little bit less common way to injure the MCL in isolation, which is what this sounds like it is. Usually if you land on your knee and twist, if you injure the MCL, there's other injuries with it, which hopefully he does not have. But this situation, if you look at it in isolation, is not super rare, where people actually injure the MCL, they're able to get back and play, and then give it 12, 24 hours when the pain and swelling kick in more. All of a sudden, they're limping, they can hardly cut on it. So the symptoms actually will uptick. So there's a lot of times guys will get back in that very game, but then they're going to be done after that. It's this kind of phenomenon where the pain and swelling are allowed to kind of increase. Now, again, they're going to do everything they can to counteract that, but at the end of the day, that's our body's healing response, so it has to run its course. And so for a likely grade 1 or maybe a grade 2 MCL, a couple weeks is, again, pretty standard. Real significant ones, high grade 2s or a grade 3, which is a complete, then you're looking at 6 to 8 weeks. But that certainly wasn't the case with his knee. I mean, if they would have examined his knee and he had a grade 3 MCL, they would have shut him down immediately. So it's likely a grade 1 or 2.
So that's where I was going to kind of lead off next. When you had that one report that said 7 weeks, how the heck was he able to play? If he suffered that in the first quarter for the rest of that, was that adrenaline, or maybe it's not as severe as what that 7 week timeline kind of?
A little bit of both potentially. So I mean, there is that adrenaline factor, and like I said, I mean, initially the injury, really the pain and swelling haven't quite set in. I mean, there's that initial ouch pain. A lot of times MCLs, people pop up and be like, I think I feel a little better. They wake up the next day and the knee's, swollen significantly, much more painful. So yeah, there is that kind of second wave, if you will. And I would agree. I mean, again, I doubt he was more than grade 1 or 2. So 7 weeks seems like a long time to me, but these obviously are very large human beings that are cutting and pivoting in ways that most humans can't. So, they put stresses that most of us don't. So maybe that is going to be realistic, but I guess we'll see if the Heat are still around at that point, but, right. Time will tell.
Could that be similar? You mentioned, the next day factor, because I remember Brian Balaga, when he tore his ACL, I think it was 2013 at Family Night, he came in the next day and just felt something like he didn't even know he tore it at family night, but it was like the next day, something he could feel something when you need. Could that happen like with ACLs too?
ACLs, yes, a little bit less common because generally in ACL you'll get some fluid on the knee pretty quickly because there's blood vessels on the actual ligament. When it rips, it bleeds into the joint. So the ACL is inside the joint. We call it intra-articular. The MCL is outside the joint, aka extra-articular. So there's a big difference. So the swelling with an MCL is actually outside of the joint, whereas an ACL is in the joint. And so usually with an ACL, people will know they did it, but it's not unheard of for people. I've had plenty of athletes, unfortunately, in my career that have come in and said, I kind of tweaked it a little bit ago. It doesn't feel that bad, but I cut. Sometimes it feels funny or shifts a little. You examine it and you're like, I don't feel a good endpoint to your ACL. And sure enough, on the MRI, it shows it's torn. So it can be a subtle injury, but generally with an ACL, there's a very large, we call it a pivot shift injury, where basically the tibia and the femur really shift away from each other. And I'm sure listeners out there who've had an ACL know exactly what I'm talking about. Most of the time, they'll look at you and say, something happened to my knee and it was bad.
Mm-hmm.
They often know.
Speaking of football, and this is going to be a very generalized question here, and I don't know if this is the right way to ask this, but I'm going to put you, say you were with an NFL team, you were part of their medical team, Vikings or whoever would be, and you're getting ready for the draft here, and you're going through all the medicals of some of your prospects and all that. Would there be certain issues, injuries, recoveries, or anything like that would maybe give you pause on a certain player, or maybe what are some certain things that some of these teams and team doctors are kind of looking at when they look at these medicals, maybe for a long-term issue for a player or anything like that?
Yeah. Obviously a broad question, but I think I can answer it pretty well. I think the first thing you're going to look at is just the injury history. So these guys will all have basically a list of injuries and then even more so surgeries that they've had. There are some surgeries that have a very high success rate with a low risk of recurrence. That being said, you're still going to examine that very closely. On the flip side, there are some surgeries and injury patterns that do not have a great prognosis long-term, and so those are ones. So, for example, we've discussed probably a million times cartilage injuries in the knee or the ankle or hip or whatever joint. Cartilage injuries are bad actors. Fractures that may have not healed correctly. Instability in a joint that seems to have recurred despite either conservative or operative treatment. Those are all things that you're going to look at very closely. Or an injury that's had multiple surgeries that just doesn't seem to respond the way that you'd expect it to. So those are things that they'll go through with a fine-tooth comb and then look at and assess and say, look, is this an injury that we think is going to be behind them, or is this going to be a chronic issue? And sometimes it's a really big deal, sometimes it's not. I mean, there are things that are career-threatening, there are things that are kind of moderate annoyances, shall we say. So let's say a guy who tweaks his hamstring every year, they may miss a game or two, and not that that's ideal, but that's different than a guy who has a significant cartilage injury where you say this guy may never step on the field. And so those are things that are going to get assessed with physical exam, X-rays, MRIs, CTs. I mean, they get it all. And right. So again, with the amount of money that these teams are investing, they want to make sure they're getting the product that they think and they want. And then on the flip side, there's going to be teams that want to take a flyer on a guy where they say, look, every team's passed on him. Yes, he's got a kind of checkered history here. Maybe it's not going to pan out, but we think the upside is there, and we're willing to risk it. And there's enough positive things on the MRI or exam or whatever it may be, where the medical team says, yeah, could it work? It might. It's not a sure thing, so don't take a first-round pick. But those guys that dropped to second, third round that are first-round talent that just have a couple question marks next to their name.
Interesting. So like J.K. Dobbins, who just signed with the Chargers, and he was a running back for the Ravens. He was one of those guys that tore his Achilles last year. But also a couple years ago, he tore his ACL. He's still only 25 years old, but he's gotten a couple of, season-ending injuries on there. Is that something that would make teams nervous, do you think, even though they're separate injuries, but ACL and Achilles for a running back, would that make teams a little hesitant to maybe bring him in for a long term?
Oh, I think, those two separate injuries, not necessarily. Now, like I said, they'll examine each of them very closely. So when you look, they'll get a very close look at that knee, and a guaranteed X-rays, MRIs were done, and of course the physical exam. So that's always part of it is players have to quote pass their physical, and that's what that really entails. And so when you look at that, the Achilles, I'm not saying people can't re-injure them. That's pretty uncommon. So that actually not a fun injury, not a fun recovery, but has a real high success rate. ACLs similarly do well, but unfortunately ACLs are not always in isolation. So you can have meniscal injuries or, again, the dreaded cartilage injury with it. So, yeah, teams will look at that and say, all right, has he recovered from that? And, again, each of those individually are big injuries. Clearly they were season-ending, but I don't think there's a team that would say, look, that guy's done. He'll never play again. I mean, I think you can get back to a high level after both of those surgeries. So, and it looks like, obviously, teams assuming the same thing.
Mm-hmm. Kind of going back to where you said, a guy who, maybe suffers a hamstring injury every year, misses a game or two in that. Christian Yelich for the Brewers is out again with a lower back issue, and that's something that has seemed to plague him throughout his career. It's giving me flashbacks of Ryan Braun with an oblique injury or that frozen thumb that he had to get, on the cryotherapy on his thumb and that. Mm-hmm. Is there just certain players, athletes that just deal with certain issues that plague their entire careers? Like back issues can kind of finicky though, and I don't know if you can necessarily fix those, right?
Yeah, back is tricky. You're right. So I mean, again, when you were asking earlier about things that can raise a red flag, that is one of them. I mean, recurrent back problems, especially when you don't have a real definitive source where it's like, look, there's a disc herniation or a bad disc or like a pars, a spondy thing, a bunch of different things that can happen. If you have something like that, okay, but some people just have low back pain, and it's a real thing. And so they don't even have to have things on an MRI. So, I mean, there's plenty of people out there that have back pain. They see a doctor getting an MRI, and the doc says, look, your MRI is clean. And the patient's like, my back hurts. And it's like, we know it does. It just there's not an actual organic physical thing that we can figure out. So, yes, those are things that, especially in a baseball player, with what they do with their kind of swinging motion, it really does put a lot of torque on the back. So, yeah, those are ones that you get worried about that you may not have an easy answer for, and maybe something that does become kind of recurrent. But I know we've touched on this past. I'm not a huge believer in the quote injury-prone athlete. Mm-hmm. I do think some people have bad luck. Now, you can have a specific joint that becomes a problem. That's real. But when it's like someone breaks their ankle and then pulls a hammy and then tears an ACL, and it's like they're not related. I just don't think that's a real thing. So I think it's just bad luck. So but you can have one problem that just keeps rearing its ugly head. That is absolutely true.
Now I know to kind of wrap it up, they said that Pat Murphy, the manager, a few days ago said that they had him on medication to see if that helped, and it didn't help. When they say medication, I mean, was that ibuprofen or inflammatory or anything like that? Does that tell you anything what they tried to do with that back issue?
Some good old icy hot. No, I bet it was probably like a steroid dose pack, perhaps, or there's some nerve-based medication. So the question with the back, is it axial back pain, meaning does it hurt right in the back, or is it radicular symptoms, meaning nerve symptoms going down the leg? So both of those can initially be treated with things like a steroid dose pack or potentially nerve-based medications like gabapentin or Lyrica that we can do to try calm a nerve down if he's having kind of like sciatica-type symptoms or what's called a radiculopathy. So those are things that can try alleviate some of the symptoms. Occasionally, if you have a lot of spasms, you can try muscle relaxers. But again, these guys are getting the kitchen sink thrown at it, so I'm sure they're trying everything that they can. A lot of times, though, good old tincture of time helps almost more than anything else. So you just got to kind of ride it out. The body gets itself right, or at least as right as it's going to be, and then you go back at it.
I mean, Shaq puts on the icy hot patches, and he can go dunk a basketball in the commercials. So
absolutely,
that
I think
should
that
work.
speaks for itself.
Right, exactly. All right, before I let you go, I'm going to put you on the spot. The draft first round next week. Your Vikings do have two first-round picks. Do they trade up and get a quarterback, or what are you thinking here?
Oh my gosh, yeah. I mean, there's so many scenarios that are going to play out. I just my concern about us making big moves to go up is I just don't think we're going to get high enough where it makes an impact. I mean, in my opinion, the top three are just above the rest of them, and I don't see us getting into the top three unless we really make a big move. And the problem is you'd have to trade with the Patriots, and I just don't like. I don't know, trading the Patriots. The Patriots always seem to win on trades, right? It's just that's always been their thing with Belichick in the past, but. So I think if we can get up to the top three, I would be happy with that. Otherwise, I think we sit and draft maybe in the lower spot and get Penix or something. I'm not a huge JJ fan. I think he's solid, but I just haven't been enamored with him. So I do think we're going to do something, though. So I do think a trade will occur, and I just don't know if it's going to be a push to go up real high or if we're going to kind of sit there more in the middle and take a quarterback later. But I mean, we need something. I mean, we just can't sit in our laurels, so something's going to have to happen. So it's going to be an exciting draft day, that's for sure.
Yeah, I'm going to be excited to talk to you on the next Friday after that first round too, to see to get your thoughts on that too. So, all right, dude. Hey, we appreciate it as always, buddy. Enjoy the rest of your weekend here, and we'll catch up with you again soon. Okay.
Yep. Take care, Dan.
You got it. There you go, Dr. Crow, Chippewa Valley Orthopedics and Sports Medicine for Inside the Training Room.